The multifidus is a muscle that most people have never heard of when I discuss it with them in the clinic at Sydney Advanced Physiotherapy. And fair enough, it's a tiny muscle with a weird name, but it is also a really, really important muscle, and it is part of your core system. When you have your first major episode of back pain, the multifidus at that level in your spine is inhibited, and the research shows that it does not come back on its own. Really commonly what I see at the clinic is when I'm looking at people's scan reports, you start to see fat infiltrate into that muscle because that muscle hasn't been active for so long. Once this muscle is inhibited, you've lost part of your deep stabilizing system, and as I said, it won't come back on its own. And the longer it's switched off for, the more it will waste away and the weaker it gets. The longer this goes on for, the more you start to see fat infiltrating where muscle once was. So it is really common that when I'm looking at somebody's scans, I actually see fat infiltrate into the multifidus. And this tells me that that issue has been there for a while and that this multifidus has not been working well for a while. So if you imagine the spine as bones stacked on top of each other with little discs in between, the multifidus goes from vertebrae to vertebrae all the way up. And if the spine is aligned well and the discs are nice and healthy and fat, then the multifidus is working at an angle that is mechanically advantageous for it. And so what it does is it stops the vertebrae from shearing forward, and when you rotate, it stops the vertebrae from shearing side to side. If you have issues with your disc for whatever reason and the disc starts to thin and bulge, then because there's less space between each vertebrae, the multifidus is no longer working at such an advantageous position. So life's already harder for it. And then if you have an episode of back pain that inhibits your multifidus, then things get even more tricky. So if for whatever reason you end up in this situation where you have a multifidus that's been inhibited by an episode of back pain, or a multifidus that's really not working well because you have some underlying disc bulges and life's really hard for your multifidus, then you can actually see that the disc breakdown will actually progress a little bit faster because you're getting more shearing at that vertebral level because your multifidus isn't able to kick in and support that spinal level. So this can also be really relevant outside of the lower back, like up in your neck or your mid-back, when you start looking at injuries sustained with whiplashes as well. So as I said earlier, the research actually shows that if something happens to inhibit your multifidus, to turn it off, it's not actually going to turn back on its own. You actually have to deliberately do work on your multifidus to wake it back up. Even if you're at the level where your multifidus is showing fat infiltrate, you can still make change. We can still wake that muscle up and make it stronger than what it currently is, and that will give you more support and stability, and that can reduce your pain quite significantly because you're not getting that shearing anymore. So it is really, really important to see a physiotherapist who knows how to do this. First, how to assess where the deficit in your multifidus is, and then how to specifically retrain it so you can connect to that spot and turn that muscle back on. Now, this is not something we learn in university. It is not something we're trained to assess when we're in university. So it is really, really important that you find physios that have made a real effort to educate themselves once they've left university, that have attended a lot of courses to train themselves up in the latest techniques and to be super aware of all the medical advances that are out there. At Sydney Advanced Physiotherapy, because we see a lot of people with back pain, we make sure that all of our therapists know how to assess for a multifidus deficit and know how to help you retrain it. This is so important. I can't stress this enough. If you would like to book in to see one of our physios, you can do so by going to our website anytime, which is sydneyadvancedphysio.com.au, and you can book online there, or you can call the clinic on 9416 4410.